Hello, my name is Kelly Schmidt, and today we're going to go over Chapter 1, Nursing Today. When you think of a nurse, it brings upon many images. There are a lot of perspectives of nurse providers in healthcare. But one thing that nurses do very well is carry on a legacy of caring. Nurses care for a collaborative amount of individuals of all ages. Families, groups, communities, sick or well in all settings. Nursing includes the promotion of health, the prevention of illness, and the care of those who are ill or disabled, and even those who are dying. Nurses must have a vast comprehensive knowledge base. Sciences, theories, psychomotor skills, critical thinking. As nurses, we provide holistic care via multiple roles and in a variety of practice settings. Upon your graduation and licensure, you will find your niche in nursing. Nursing as a profession. In the nursing profession, we will always use critical thinking skills. Nurses will administer quality patient-centered care, and as nurses, we must be responsible and accountable. We must understand the scope of professional nursing practice and how nursing influences the lives of your patients, their families, and the communities that they live in and that we serve. Nursing requires the current knowledge and practice standards, an insightful and compassionate approach, and critical thinking and clinical judgment. There are different stages of nursing: novice, advanced beginner, competent, proficient, and expert. The transition from student nurse to nursing profession can be a huge adjustment. It's difficult as new graduates face the realities of the differences between nursing education and nursing practice. In stage 1, as a novice, this is a nursing student in their first year of clinical education. This is a nursing student in his or her first year of clinical education. Novice nurses have a very limited ability to predict what might happen in a particular patient situation. It won't be till that a novice nurse gains experience that he or she will feel more comfortable and will have a not so limited amount of information and knowledge to become more flexible in their standard practice care. In stage 2, you become an advanced beginner. That is a new nurse in their first job. Nurses that have more experience enable them to recognize recurrent and meaningful components of a medical situation. As a new nurse, you have the knowledge and the know-how, but you don't have a lot of in-depth experience just yet. In stage 3 is the competent stage. These nurses lack the speed and flexibility of proficient nurses, but they do have some mastery and can rely on advanced planning and organizational skills. The competent nurse begins to start to recognize patterns and the nature of clinical situations more quickly. At stage 4, nurses are capable to see situations as a whole rather than parts. Proficient nurses learn from their experience, from the events that typically occur. And they can modify plans in response to different events. Stage 5, expert. Nurses who are able to recognize the demands and resources in situations and attain their goals are expert nurses. These nurses know what needs to be done and how. They have a grasp of every situation based on their deep knowledge and experience in the nursing field. Standards of practice are the minimum acceptable guidelines for providing and evaluating nursing care. The standards of professional nursing practice are published by the American Nurses Association. The ANA works to ensure quality care and provide legal criteria for care. Nurses must follow processes to assess, gather data, prioritize nursing diagnosis, plan care for patients, implement, evaluate. We must follow the standards of ethics, cultural practice. We must be good at communication. We must be good at collaboration. We must have leadership skills. We must follow evidence-based practice. We must care for individuals of all ages, families, groups, sick or well. Nursing includes the promotion of health, the prevention of illness, and the care of the ill, disabled, and dying. We also need to promote safe environments, research, health policies, health system management, and education. Nurses must practice and conduct guided by a code of ethics. Ethics refer to the standards of the right and wrong behavior. Historical influences. Once again, nurses respond to the needs of patients. We actively participate in determining the best practices. The knowledge of the history of nursing profession increases your ability to understand the social and intellectual origins of the nursing discipline. For example, Florence Nightingale. She established the first nursing philosophy based on health maintenance and restoration. She organized the first program for training nurses. She was the first practicing epidemiologist. She improved sanitation in battlefield hospitals, and she remains a basic part of nursing today. Florence Nightingale helped us as nurses to be caregivers, to practice with autonomy and accountability, to be an advocate, to be an educator, to be a communicator, and to be a manager. There are many levels of becoming a professional registered nurse. For 2 years, you gain an associate's degree. For 4 years, you can get a bachelor's degree. After that, you can go on for a graduate education, master's degree, advanced practice, registered nurse. You can even go on for your doctorate. And there are plenty of continuing and in-service education opportunities. For the 2-year or 4-year program, all students must take the NCLEX, the National Council License Examination for Registered Nurses. There are so many things we can do as nurses. We could be a clinician. We could be an advanced practice registered nurse, which includes clinical nurse specialist, nurse practitioner, certified nurse midwife, certified registered nurse anesthetist, a nurse educator, a nurse administrator, or a nurse researcher. That's just a few. Nurse Practice Acts are laws that set the legal limits of nursing practice and define the scope of practice within each state or jurisdiction. These acts are actually laws, and nurses must be familiar with them when they practice nursing in their state. Legal terms can be implemented so that nurses clearly understand what they mean. In addition to the Nurse Practice Acts, each healthcare institution can add its own policies and procedures that the nurses must follow. There are many professional nursing organizations that you can join. The Professional Nurse Organization will address member concerns. It can include specialty nursing organizations. They present educational programs, they publish journals, and there are student organizations, the National Student Nurses Association and the Canadian Student Nurse Association. Some key points to remember. I'll just go over a few. There are numerous professional nursing organizations that support nurses in advancing their nursing practice and expand nursing roles into specialty areas. The professional nursing organizations also offer educational programs and journals. Nurse Practice Acts are laws that provide the scope of practice as defined by each state or jurisdiction. Ethical behaviors guide nursing practice. Some other key points. An RN's education can consist of a 2-year, 3-year, or 4-year BSN degree, and an RN can practice in most healthcare institutions. You could be a master's prepared nurse, or you can have a terminal degree such as a doctorate or a PhD, or a DNP. Nurses are learning at every level. We must learn the norms, the attitudes, the behaviors, the skills, the roles, the values. And we can do this by finding a mentor or a preceptor. We can also look for further certifications and memberships to professional organizations. If you have any questions, please reach out. Please review this information in the course of study. Please look for the adaptive quizzing. And if you would like additional questions or resources, please reach out or check course tips and course announcements. Thank you for your time, and I'll talk with all of you soon. Thank you.